Surrogacy is different from regular pregnancy in a lot of ways, but the most obvious is it's just not something that can occur naturally or accidentally. Pregnancy for surrogacy is achieved through in vitro fertilization, which requires medical intervention to suppress your regular ovulation cycle and essentially hack your body into accepting an implanted embryo without an ovulation cycle. This is done through hormonal medications that often include oral medications, vaginal suppositories, and intramuscular injections, and lots of monitoring by the reproductive endocrinologist. Once a medication cycle begins, it usually takes about 2 to 4 weeks for your uterine lining to be optimal for embryo implantation. But the doctor will check your lining weekly through ultrasound and lab work to make sure you're ready. Once the doctor decides the time is right and the date and time are set, things start moving on a very strict timeline. Embryos have to be defrosted, and transfer time is set to the exact hour to make sure the embryo is ready to transfer at exactly the right time. So your schedule needs to be flexible to accommodate this. Because all of this effort is taken to achieve pregnancy, many doctors require surrogates to rest for 24 to 48 hours, which basically just means laying around, watching Netflix, and doing nothing to make sure that the implantation of the embryo isn't disturbed and giving it the best chances of success. In your own pregnancy, the first signs that you might be pregnant were probably a missed period or fatigue when you were around 5 to 7 weeks along. With IVF pregnancy, the exact moment of conception is known, and you'll know within 10 days of embryo transfer whether or not it was successful. In your personal pregnancies, you might not see a doctor until you're around 10 to 12 weeks along, and then you might see them once a month after that. With IVF pregnancy, everything is so closely monitored in the early weeks, and you'll most likely see the doctor once a week, if not more. The heartbeat will be confirmed by ultrasound around 6 weeks by sight before it's even able to be heard. Your hormone levels are going to be monitored closely to make sure you're taking the proper amount of medications to sustain the pregnancy until your body catches up and your placenta begins producing the hormones itself. It's a very exciting, but also kind of a nerve-wracking and time-consuming first trimester. The other big difference that makes all of this easier to bear is that you'll begin receiving your compensation, which will be broken into 10 monthly installments, starting upon heartbeat confirmation. This makes all the appointments, medications, and possible nausea a lot more palatable.